So we have a resident here from the community who would like to share about the recent changes that have been occurring over the past 5 years. So hi there. Thank you so much for joining us. So how long have you been living in the community for?
Hi, I've been here pretty much my entire life, so over 30 years.
Okay, great. Do you have any information that you could share about how your community has been changing over the past 5 years in terms of like diversity, health needs, or anything that is really affecting the residents in your community?
Absolutely. So, I mean, the kind of the elephant in the room with that question would be the pandemic. Buffalo hosts a number of nursing homes, so we had tremendous number of elderly people pass away in the past 5 years. So, obviously, our demographic just got young due to some economic conditions changing. But I have to imagine there are more homeless with children. Average age of the population coming down, and the average rate of homelessness going up. I have to imagine that pediatric concerns have gone up. That said, a lot of conditions that would typically affect older folks are probably less in demand from a medical professional's perspective. The millennial generation is entering their late 30s and early 40s, so you'll probably see more need for things like urologists, at
Okay.
least for that cohort, specialists that typically pick up later in life. Basically, anyone that sees a man, because we all know most men will stop seeing doctors at 18 and start again around 40.
For sure. So, do you know if there's any specific concern about like substance use or alcohol in your community specifically?
Yeah, so Buffalo, we like to regard ourselves as a drinking town with a sports problem.
Yeah.
So alcoholism is rampant. And even prior to legalization, that a high percentage of people were driving around stoned. We have problems with
Yeah.
substance use here for sure, particularly on the west side of the city, which is probably the most diverse population wise. We have a large number of people who've moved from Puerto Rico to
Okay.
take advantage of social safety net programs that we have here explicitly for them. A lot of times they're coming over with no marketable skills or familiarity with the language. So a lot of these people need assistance, both medically and financially and education wise.
You mentioned when I spoke to you last an increased crime rate or an increased reckless driving.
Yeah, having spoken with other people who are just on the road, it's
Yeah.
noticeable for everyone. Everyone that drives here has noticed a recklessness. That's the best way I can put it.
Okay.
You have to imagine that they're dealing with a higher rate, serious injuries and mortality on the road.
Yeah. Do you know if there is a large veteran or refugee community?
Yeah, so the American Legion is right on Kenmore Avenue, I believe, and there's another one in Lancaster.
Okay.
So we have, just a relatively large population that frequents the VA hospital.
Going back to the pandemic, do you know if there were any like initiatives to help people with the isolation, the depression, mental health?
I know that it was addressed, but I believe it was largely lip service
Yeah. Yeah.
from the governor and some politicians. I don't think anything to really bring people together in any respect really
Right.
materialized during that time.
Okay. Do you know, like, relatively what the mental health status of community members are?
Judging by the number of addiction treatment facilities and health aid facilities that we have in the area, I'd say we probably have a sizable portion of the population that is in serious crisis. And it makes sense. We have, I think, the largest mental health facility outside of New York City within the state,
Oh, yeah. Yeah.
right here down in Elmwood.
Do you find that you have adequate resources and clinics within a reasonable distance?
I have mixed feelings about that. We have a good number of clinics, a good number of clinicians. However, many of them are students. And because of the diversity of our population and because of the number of people we have that don't have adequate insurance to cover their needs,
Hmm.
there are a tremendous number of people that rely on Medicaid
Okay.
and not enough facilities that accept it and have qualified clinicians that are concordant enough with the population to properly serve them.
Okay.
So, for example, a few years back, I was not doing well myself financially. I was in that position and I had two or three doctors in a row that I simply could not understand because their accents were so thick. And
Okay.
it was not conducive to a good client doctor relationship.
Right. Okay. Thank you for sharing this information, by the way. Do you know if there's been any initiatives or interventions aimed at improving the community's safety?
I mean, we have a number of community driven initiatives, but we have former gang members, for example, that try to actively talk to people that are in gangs and encourage them to pursue other avenues.
Wow.
We have a community outreach program by the Buffalo Police Department that tries to get kids active and involved in sports
Okay.
and encourages them to stay in school. The Be a Friend program helps to reach out to, I believe, disaffected young boys in general, or maybe it's just kids now.
Okay.
But tries to hook them up with a mentor, particularly those that are missing either a father figure or an adult in their life that they can look up to. So yeah, there are some outreach programs here, and I think in that respect, we're probably doing a lot better than most places.
Are there any other comments that you'd like to just share about the community?
Yeah, so I just based on my own life experience, I know for sure that we have a good network of halfway houses, women's shelters for those that are abused.
Okay.
We have a reasonably good network of resources for people that are in crisis, but we are criminally underserving people that are just exiting crisis, but in limbo in terms of bridging the gap to functional life.
Yeah, that's definitely important. Do you feel that you live in a healthy community? Do you feel safe? Do you feel that most of your needs are met, or is there still a lot of work to do to cater
Um,
to everyone's needs?
I mean, our violent crime rate has dropped significantly in the past 5 years. Car theft and break ins are occurring more. I've seen a lot recently that is
Yeah.
concerning, like people trying doors and things like that. From talking to police officers, from reporting things myself, that our police are actively avoiding enforcing some laws because they're essentially crying about bail reform. Good. I imagine things will get worse before they get better, if nothing else, because of that protest movement.
Well, thank you so much for meeting.
It's been my pleasure. Thank you.